So, good afternoon, everyone. My name is Daryl Sulier-Lamb, and I am the Mental Health and Wellness Manager with the IPHCC, or the Indigenous Primary Healthcare Council. For those of you who don't know, the IPHCC is an Indigenous governed, culture-based, and Indigenous informed organization with a mandate to support the advancement and evolution of Indigenous primary healthcare services throughout the province. We wanted to let everyone know that we are also hosting another Lunch and Learn this Friday with our guest speaker, Dr. Ed Connors, who will be discussing life promotion and suicide awareness. So if you are interested in attending that one as well, we'll be including a link to the registration in the chat. With all of that said, we would like to welcome you to our Lunch and Learn today, where our wonderful speaker will discuss traditional medicine, sustainable harvesting, and how two-eyed seeing can benefit patients in a holistic way. As a reminder, your camera and mic will be muted throughout the presentation, but if we have time at the end, we will be using the Q&A function for questions at the bottom of your Zoom there. So with all of that said, the IPHCC is proud to present our speaker, Joseph Pitawanakwat. Joseph is Ojibwe from Aquemacong. He is married with one daughter, and he is the founder and director of Creators Garden, an Indigenous outdoor and online education-based business focused on plant identification beyond sustainable harvesting and teaching everyone of their linguistic, historical, cultural, edible, ecological, and medicinal significance through experiences. He has learned from hundreds of traditional knowledge holders and uniquely blends this knowledge with and reinforces it with an array of Western sciences. So with that, I will pass it over to you, Joseph. Take it away.
All right. Okay, let's go. This is going to be fun. Been actually looking forward to this for real long. It's like, oh, when's the last time I did like a legit online presentation? It's been like 2 weeks. I just got back late last night. I was on Manitoulin. It was real funny. On last week, my air conditioner broke in my car, and I had to go to Manitoulin to speak to a group about diabetes, and so that kind of inspired today's session a little bit. But it was real hot because my air conditioner didn't work, and my car said it was 38 degrees when I left Peterborough, so I had to have all my windows down, and then it was real loud, so I got probably about an hour down the road and with all the windows down. And I was still sweating in the car, like with all the windows down. And I remembered I stole my wife's headphones, noise canceling headphones. Oh, it's distracted driving though, but it was so loud. And then all the receipts I had, they're all flying everywhere. I had milkweed pods. I thought I had them all inside my garage, but I must have left a few of those milkweed pods from last year in my car, because there was just milkweed fluff like everywhere, just flying all out of my car, like a big trail of them behind me. And then like the whole way, like 7 hours like that. But those headphones worked real good. They were real quiet. And then it was on Sunday I was driving. I present on Monday, so it was Sunday I was driving, and then it was I was wondering how come, usually on Sunday everybody's going back from their cottage, and then so people want to pass you, and I don't like to drive that fast. Like people here drive crazy. So I was wondering how come everybody is being real nice. They're waving away, and then I'm waving back at them, and just they're smiling, and I was just enjoying myself. I don't like when my little hairs they flap around and tickle on my face. So I found a hat. The Inuit group gave me a hat. It was real small though, a white one, a baseball cap. So I put it on backwards just to keep this hair off my face. Then those big headphones. Then I thought, oh, people must think I look funny. They were smiling and waving at me. And then I got 3.5 hours. I was at Magneton, then I had to pee real bad, so I went out, and then I saw half of my bumper in the back was just hanging off. I was like, oh, that's why everybody is waving at. They're trying to tell me my bumper is falling off. So I found some tape. I taped it back up. And then I went. Then I had my presentation, and then I came back to Peterborough, and it was even hotter the next day. I was just sweating away. I was real exhausted when I got back, and then I text my mechanic if he can fix my AC. Yeah, we'll put you in front of everybody, because I give him moose meat. We'll put you in front of everybody and we'll fix that. Because I had to go back to Manitoulin on this weekend. I was filming with TVO on Friday and Saturday. Then I had a big project to get started on in Shishiguaning. So I was on Shishiguaning yesterday, and then and my air conditioner was fixed though. It was real nice driving with the windows rolled up. It was a great big relief. And then I was trying to think of, like, not too long ago, like before there was AC, oh man, no escape from the heat. Thought, oh, I wonder what I would have done. So I guess because of that experience, I've been thinking a lot of what it was like, not that long ago, like my grandma's stories. So I would just go and visiting with my grandma, like a lot of things about her life and the way that she was raised, the way that she was raising her kids. That's some of my favorite ideas, is that she never had access to a hospital. She never had air conditioning. She never had a car growing up. They just walked everywhere. Oh man, it was so fun. Like when I was filming with TVO, you have to be really careful the words that we use, and it was a little bit unusual filming with them, but we had lots of fun. And at the end of the day of filming, I said, I want to tell you guys something. We didn't get to cover it in this segment because it's inappropriate for a television series for kids. But I just want to tell everybody, like, where my knowledge comes from, because the story that I told them is my grandma, she never practiced like medicine. She didn't dedicate herself to learning about medicine. For her, it was just kind of like a normal thing. What her extension, the extent that she knows the Shabamshkike is just like what you had to. Just like if your clothes rip, you have to know how to sew them back up so the rip doesn't get bigger. If you're hungry, you cook your food. You have to know how to cook so that you're not hungry. And if you get sick or injured, you have to know your Anishinaabemowin to fix yourself, because there's no hospital, there's no doctors. So for her, it was just like a normal part of her life. And she never dedicated herself to learning about medicine. Her mom did. Her mom was raised with medicine people, and that was her role in Wikwamkong, in my home, was to be a midwife, mostly, but to also like give people the medicines that they needed. But my grandma herself didn't dedicate herself to learning about medicine. So she would always say, you shouldn't learn from me, because I didn't study this. This wasn't my job or my role. But I knew she knew a lot. And so what I told with TVO when we were filming is that because they did not have horses, they just walked everywhere. They would just walk through the bush. They had footpaths everywhere. And in Wikwamkong, a lot of the people would think my great-grandma, so my grandma's grandma, was like strange, a little bit strange. She was always talking to herself. She would always mumble to herself, and she just was never quiet. And my grandma said she wasn't crazy, she was, and she wasn't talking to her. Well, she was talking to herself, but it was like she was talking to the plants. So when they would walk through the forest to get to somewhere or to get anywhere, she would see all of the different plants and she would just say, oh, I know who you are. I know what your name is. And I know which part of the body that you're going to help to heal. And I know that because I watched you when I was a little girl. I watched my mom give somebody you and use you like medicine, and I watched you fix that person. So I know what your gift is, and I know because I've seen it. And so my grandma sitting there listening to her mom talking to all of these plants, saying, I know who you are. I know what part of my body that you can fix, and or which part of the body you are designed to fix. And I know this because I've seen it before. And I know you, I know what you can fix. I know you and what you can fix. So my grandma was tuning into all of those stories. And it's one of my favorite images of just like, you imagine just walking with somebody with that amount of knowledge and that amount of experience. And so my grandma just tuned in like a radio and was just downloading all of those stories and all of those uses, all of those plant gifts, all of those purposes. And my grandma would always say, like, I didn't do this. These aren't my stories. There's just things that I heard. And and so I was telling, TVO, like, that's what happened, right? That's how we learned, or that's how I learned is my grandma told me the stories that her mom would tell the plants. So it's like then it came to me. And so that's how I started to learn about medicine, and that's how I started to, find plants and then I would pick them. Then the community people would know, oh, Joe found this plant, Joe found that plant. So they would take it from me. And then I would see them a few weeks later, and whatever their condition was, whether it was a simple condition, I don't know, like, I don't know, like a lot of like diarrhea or something like simple like that. Oh, sorry, it's lunchtime. But yeah, like real simple stuff. But also too, like people were taking medicine from me, and it was helping them with like really chronic conditions that take a lifetime of abuse to develop. They're just helping with idiopathic conditions, like conditions that we don't know what the cause is, let alone how to treat it. So we use comfort measures like arthritis. We just have pain management. We don't really have a medication that can actually help with the arthritis. Now we are experimenting a lot with biologics and immune suppressants and stuff that seem to help a little bit, but not what I was seeing. I was seeing like reversal of idiopathic conditions. I was seeing arthritis, people who couldn't move fingers again, or they'd have a real crooked finger. And so they've had a finger that was crooked, pointing in the wrong direction for 30 years. Then that medicine would fix it and it would be straight. So then people would see me at Andy's at the grocery store, and they're like, oh, I have to learn. I'm used to pointing like this because their finger was crooked. So they would have to point their hand crooked so that their finger pointed straight for 30 years. Then they used that medicine for a couple of weeks or a month or so. Then their finger was straight. So then they have to learn how to point straight again because they're always pointing crooked, but their finger is straight now. And so people are saying this stuff. So I was like, oh, so I started to gain and acquire experiences. But after filming with them for the day, I was like, I want to tell you guys, like, just off camera, like actually where these stories come from, because I think that this is very fascinating. For residential schools, they did lots of medical experimentation, nutritional research. So to figure out, pablum is a very famous for being developed in residential schools, the formula we give children. And so lots of the unethical studies happened within residential schools. And so when they would come to take the children, they had who was funding a lot of these operations was the experiments. So they had inclusionary criteria to satisfy when they're collecting children and on the reserve. And for years, they were taking boys. They needed boys for certain experiments, so that's what they were taking. And my great grandma, she had her two sons, but she had lost them in the war, so she needed a helper, somebody to help with the medicine picking, somebody to help with the garden. Needed to have. She can't do that on her own, so she had my grandma really late in her life. And my grandma was her little helper, but the inclusionary criteria for the studies changed to little girls. So my great grandma was upset because she's like, no, I got a little girl now. And so she put my grandma in like dirty overalls and cut her hair off and taught her how to try to talk in a deeper voice, like a boy, to act like a boy. And then and all coming down into this one moment where she's standing on the side of the road with the wagon coming by taking the kids, and she said, "Here's my son," and the wagon went by, didn't take my grandma. And so I wanted to share with them and with everybody, just kind of like, it's kind of fascinating that it almost came right down into that moment where my grandma was able to stay with her mom and listen to those stories and tune into that radio and download all of that knowledge while her mom was talking to herself, talking to the plants. And then for my grandma to be able to amass that knowledge and those stories so that I could share them with you guys. And we even have a picture of my great grandma Bridget and my grandma dressed up to look like a little boy to sneakishly escape that situation that they were in. But just kind of interesting to know, like for me to be so privileged to get all of that, like what stars have to be aligned for me to be sitting here with what I know now and what I have experienced. It is just that incredibly privileged. So I'm really happy to be able to share with everybody today. So my I really like I really like where I'm at right now, and I really like to be able to share as much as I can about medicine. I know our Anishinaabemowin is very, very valuable, and it's very special. It's very effective, and it works very quickly. It's tremendous. So when I started to learn and started to give medicine to people and see how amazing it was, I became obsessed with maximizing my impact. Everything that I do, all of my motivation is inspired by my possible impact. So I want to do the best that I can. If all of these stars align to put me into this position and for me to have this knowledge, this gift of knowledges, this young, I want to do the best that I can with what I got. And so I thought, I'm not just going to sit in Wiki and give people medicine that they ask for. I'm going to teach large groups. So then I started teaching large groups how to do their own, and make it for their own family in Wiki, because that seems to be more impactful. Teach them how to fish. It's old, funny analogy, but yeah, teach everybody how to fish instead. So then when I started teaching large groups, I started to run into problems. This obsession with maximizing my impact has put me right in front of so many different barriers. One of the biggest barriers that I acknowledged very early on, and one of my biggest barriers now, is usually primary healthcare clinicians like physicians, nurse pracs, pharmacists, because they have a college that they adhere to. That college has guidelines of conduct, and in their guidelines, it's really clear that if there is an alternative care strategy, an alternative therapy like plant medicine, and there's no evidence to support it, then it must not be supported. So because the reasoning is very simple, a physician is not going to understand the chemicals inside of the plant. They're administering chemicals in the form of pharmaceutical drugs, and if somebody is using a bunch of plant chemicals, we don't know if they're going to fight each other and cause this person to become sick or die. So if somebody wants to use plant medicines, they have to say that you can't use plant medicines and pharmaceutical drugs. So my job was to learn all of the chemistry inside of plants, and what each one of those chemicals do inside of the body. Because then once I can understand what the plants are doing inside of the body, then I could educate the doctor or the pharmacist or the nurse prac on, this is what the plant is doing. And I don't see a contraindication, or in some really rare, unusual circumstance, sometimes there is a contraindication that I can identify, but for the most part, with our Anishinaabemowin, there's not, at least with the plants medicines that I teach about, I don't really have contraindications to identify. So I teach actually that, these are the chemicals in the plants. This is what they do inside of the body. This is what the drug does. And we could see that these two things work so well together, and that we should actually partner, and we should actually be a really good team together to help this patient. So that barrier has been probably the most prevalent and dramatic, and that's where I spend most of my time. So I'm kind of known as the guy who learns all of the chemistry inside of a plant and learns all of the pharmaceutical drug mechanisms, and talk about both of those and how we could work well together. And so that's been my major responsibility, I guess. So yeah, I guess kind of like this two-eyed seeing sort of approach, and I really want us to be able to see the value in that partnership, in that relationship. And so my experiences now for the past decade or so have been focused on that great partnership, I think. Yeah, so yeah, that's me in a nutshell. I want to show you guys some real cool stuff though. What I've been really kind of focusing on lately. My obsession with maximizing my impact has put me in front of barriers that I have had to overcome. One of those was learning about chemistry. Another one was having to learn about nutrition. We'll kind of talk a little bit about that today. But I wanted to give us like a really good understanding of where I'm coming from, and kind of my experiences, my methodology, these sorts of things. So I guess I could just jump right into it. I wanted to share with you guys two different plants. One, the one that we will start with, it has some of the most fascinating stories. I'll just pull it up so you guys could see. It's one of my favorite trees, and absolutely, definitely, without question, the most aesthetically pleasing and brilliant tree that we have in this entire territory is called striped maple, Acer pennsylvanicum. And the Anishinaabemowin, we call it mosmish. Mosmish, mos, of course, is a moose. Moose is what those sounds describe is a professional twig eater, a professional defoliator of leaves. So their job, their responsibility is pruning the boreal forest. And so we call them moose. You know, in the Anishinaabe language, if you say mo sans, when you say ans on the end of a word that is diminutive, right? It makes that thing become very small. So like Joe is Joe, but Joe ans is like a small Joe. So if you say moose, that's a moose, right? We all know what a moose is. But if you say mo sans, what do you think that is? Mo sans. It should just be a little moose, right? But it's not. Mo sans is a caterpillar. And it's the same action, right? The professional defoliators, the leaf eaters, the twig eaters. So Moses is a fun word to understand. Mosmish is the moose tree. And so as a kind of traditionally trained ecologist, one of the things that we understand is that moose actually don't interact with this tree very much. They don't like to eat it as food. And it's documented very well that sometimes when moose go up to striped maple, they go to eat it and then they stop. Because, and then they'll go and eat something else, an alder, a willow, an ash, whatever. They won't eat the striped maple. They'll actually stop and then go on to something else. So ecologists will say moose actually don't seem to enjoy this as a browse, as a food. So, you know, they have a really interesting relationship with striped maple. And there was this one amazing study in the States who was looking at why moose tend to run along the road. They can run along the road for like 10 kilometers. Like they use the road for a reason. They wanted to figure out why. And what they figured out is that the moose use the road to escape from wolves. When they're getting chased by wolves, the moose know wolves don't like the road. So if the moose can just get to the road, they're home free. They could just run along the road until the wolves stop pursuing them. And I was reading the study and I thought, oh, this is fascinating, you know, for moose to know this. It's really cool. There was a little link in that study though, and it was the data that was excluded, outlying factors it was called. And so I read this, the outlying fact, I followed the link, and what it was they had all the moose that were collared, right? And so, you know, the moose were meandering about throughout the forest here and there and everywhere. They'd run away from wolves, they'd get to the road and they would run along the road to escape. But sometimes when they were on the road, they got hit by a car. And when moose got hit by a car, they began to act what the study called mentally deranged. So what happens is the moose would run in a straight line. It would not meander about. It would run in a straight line, sometimes for a few kilometers, and it would stop for a couple hours, run in another straight line, stop, straight line, stop, straight line, stop. And it had followed this pattern, sometimes for days. So when the ecologists went to figure out what that moose was doing, it's eating nothing but striped maple. And it was really unusual because it's like, well, this food that they don't normally eat, that they actually avoid eating, if they go to take a bite, they'll stop and eat something else. Now, all of a sudden they get hit by a car and that's all they're eating. So this moose is obviously mentally deranged. And when I read that study, I knew what was happening. What was happening is that moose knows the medicines that it needs. So this is a medicine, the striped maple. These are the leaves when they're young. They don't really look like a maple. When they get older, they grow those thumbs off the side that actually make it look like a maple leaf. I just wanted to make sure that I noted that in the little video. But yeah, when you're looking at the striped maple, I know that in practice, this medicine, we use it for cardiovascular issues, heart disease risk, heart attacks and strokes, varicose veins. This is actually one of my favorite medicines to show people that, to dispel the idea that plant medicine is something that is, and it should be a part of a lifestyle, that it's not necessarily a therapy that you could use, but that it needs to be a part of your everyday life, and that you use this medicine all the time and that's the only way. You know, we use Western medication and it's instant, it's fast, it's effective, it does what it's supposed to do, and that's why we like it. Plant medicine is different. It takes a long time, takes dedication, this is my favorite plant to dispel that idea. Some plant medicines offer an incredible therapy really, really quickly. One of those, and so I use striped maple to show people, because with varicose veins, like you have vascular inflammation, you get bulging veins inside of your legs and arms, back, whatever. And when I make this tea, I know when I'm doing community work, people will drink one or a couple cups of this tea during the presentation, and they'll come back the next day and all of the varicose veins are gone. Hemorrhoids are a varicose vein as well. So, you know, dramatic, fairly immediate relief from hemorrhoid. People are pretty happy with that. And so you could see the effect of it. So if a varicose vein, spider veins, if this issue is just a manifestation of vascular inflammation, and inflammation drives more chronic diseases like atherosclerosis that ends up as heart attacks and strokes. If that is caused by inflammation, and we can have a tea and the next day all of the varicose veins are gone, that tells me that this is helping to deal with vascular inflammation in the acute phase, in the form of a varicose vein. But then also it should be able to help with some of the more chronic conditions. So I wanted to share this one with you guys today, because I wanted us to be able to see and understand that plant medicine is an incredibly valid form of therapy for both acute and chronic conditions. And this is kind of like my gateway medicine. When I make this for a large group and we have it, we could see the effects of it the next day, whether we had a half a cup, or a couple cups of the tea, which is a really delicious tea. Also, you could see the effects of it right away. So if this worked this quickly, like almost instantaneously, so then to help this part of my body, are there lung medicines and liver medicines and bone medicines and kidney medicines and skin medicines and women's medicines and child care medicines? If this medicine helped this quickly, what other supports are out there? And so I use this plant in this tea as a way to be able to get us excited about the validity of Anishinaabemowin as a valid form of therapy. Like, this is actually going to help. I am. And then it's also fun to see, you know, like obviously what happens, you know, when a moose gets injured. I use this a lot in diabetics as well. Diabetics who, you know, deal with a lot of vascular inflammation, who bruise easy, and the bruise takes months to be able to heal, weeks if not months. Then we could drink this tea and the bruise heals very, very, very quickly, even in the case of somebody who is a uncontrolled diabetic. They're able to heal, their bruises are able to heal really, really quickly. So then you think about limb preservation, you think about, like, we could start to think about all of these things. How valuable could this one plant be just within that one context alone? So then I like the idea too that, you know, at one point throughout our history, we are simply, I guess, observing moose. We see the way moose use it. We see that they're using it when they get injured and they're going to have a bruise, like getting hit by a car. They go straight to striped maple. They're not mentally deranged. And when they're in the forest and they go to eat a striped maple, they say, hey, I'm going to save this for when I need it. If I ever get injured and I'm going to have a bruise, that's the medicine that I need. So I'm going to save this plant. So when they do get injured, like get hit by a car, they go straight to striped maple. They eat all of the bark, and they'll go straight to another patch, eat all of the bark, and they could do this activity for a few days. So Anishinaabe, we call it muzmish because we understand moose's relationship with that plant. And that helps us understand the use of that plant as well. And my absolute favorite idea are these bright blue lines going up and down the tree. So this identity is embedded right into the tissue and physical structure of this plant. You could see and relate to it almost immediately, our cardiovascular system, to say, this medicine, that's the part of your body that it's going to help, your vasculature. that reinforced by the moose story, and like all of this kind of working together on top of the experiences that we've had with varicose veins and aneurysms and things like that early on. I know that this is one of the most powerful medicines that we probably have, or impactful medicines that we probably have. Again, my obsession with impact, right? So in understanding this one plant, and having all of these experiences, it's my favorite to share. You know, cardiovascular disease is the ‑1 killer in Canada and Indigenous communities and in every developed country on the planet. If there's any help and support that we can provide to our cardiovascular system to prevent this issue, I want to be able to provide that. And so the striped maple, just, you know, finding ways to funnel this into communities, I think that this is probably going to be one of the most impactful medicines that we could ever learn about. So I thought I want to talk about this today. One of the things that I really wanted to talk about too is the actual mechanism of it. It's really interesting. So in understanding, in looking to understand what striped maple does, how it's so effective, what the heck does this plant do to your body to cause that effect? It's actually really, really simple. So really basically, and as quickly as possible, I generally like taking my time with this because cardiovascular disease is so massive and such a huge issue. But just for the sake of this shorter presentation, give you the quick version. When you eat carbohydrates, your blood sugar goes up. Insulin brings that sugar down. Insulin is a hormone that sends that sugar into your muscles. But if your muscles are already, you know, full of energy, their sugar is not allowed into your muscles. So it has to go somewhere else. So when the sugar that we eat is not allowed to go into our muscles, say because we're not exercising or you know, we're already developing this kind of resistance to insulin, then the sugar is not allowed into your muscles. It has to go somewhere because you're going to die. So what your body will do is it'll create a list. Okay, which parts of my body are the easiest to replace? We'll just send the sugar there because sugar is toxic to almost every cell and tissue inside of your body, with the exception of very few, very specialized cells that need sugar. So wherever the sugar goes, it's going to destroy those tissues. So your body will say, which parts are the easiest to replace? We'll send the sugar there. It'll destroy that tissue. And when the sugar goes back down, we'll replace the damages that the sugar has done. So one of the first and easiest places are your endothelial cells. That's the lining of your blood vessels. Mesangial cells in your kidneys, nerve cells, your eyes. These are glucose disposal sites, primary glucose disposal sites. So that's where your body will send the sugar to destroy that tissue, but it's easy to replace, so we'll just fix it later. The problem is that our sugar never really goes down, and you know, we're just constantly insulting these tissues with eating inappropriate exogenous carbohydrates, so eating too much sugar. And so this tissue never has the time or the opportunity to recover. So what happens then is your blood vessels become damaged. And it's important to understand all of this because the mechanism of the striped maple, all the striped maple does, and the exact mechanism of it is not very well understood yet. So I don't want to bore you with all of the different theories about how it does this, but all it does is it protects your endothelial cells from sugar. So it prevents the endothelial cells from being able to absorb the sugar from your blood. So what that means is then not that. So what's important to understand is the sugar is not allowed to go into your blood vessels anymore to destroy those. So all of that sugar is going to be forced to go to your kidneys, your nerves, your eyes, and cause damage in alternative glucose disposal sites. So those, where the sugar goes, we could probably understand, you know, when you have diabetes, you have cardiovascular disease risk, atherosclerosis, you have macular degeneration and glaucoma. You have peripheral neuropathy, destroys your nerves. You end up on dialysis because your kidney function goes down. That's why. It's because that's where all the sugar is going. So now you protect your blood vessels from sugar, and all of the sugar has to go to those other sites. So they take on more of a burden with the eating of carbohydrates. They're taking on that extra burden because for now, as long as we're having the striped maple, this tissue is protected. And when it's protected from sugar, it's able to heal. And in a very short period of time, just from being protected from hyperglycemia, from high blood sugar, that's the healing that we experience. So that's all striped maple does. It's protect you from sugar and prevent this accumulation of inflammation. And one of the reasons and ways and whys I was able to learn about this is because that's actually the mechanism of statin drugs. We always think of statin drugs as cholesterol lowering. You know, they'll lower your cholesterol and that protects you from cardiovascular disease, but it's very well understood now that statin drugs, that's actually a negative side effect of the drugs. Most of the negative side effects that we experience from statins are because they lower cholesterol. That's not why they protect us from cardiovascular disease risk. They have a small, they inhibit slightly the toxic effects of glucose. So they prevent sugar from going into the blood vessel cells. And they lower because of that, they end up lowering the amount of inflammation that's inside of our blood vessels. So they essentially do the same thing as striped maple. Probably to a far less degree, according to my experiences in communities that we worked in so far. But it's really fun to understand what drugs are doing as well. So like most primary care clinicians, I'm always encouraging, you know, a continued education in disease pathophysiology, but also a continued education in drug mechanism. Like we got to learn exactly what statin drugs are doing, what metformin is doing inside of the body, so that we could have these conversations. And because of me learning about plant mechanisms, plant chemistry mechanisms, I've had to learn a lot about pharmaceutical drug chemical mechanisms. So I've done that learning to learn exactly what drugs are doing. And often when we're looking at plants, they're kind of doing pretty well the same thing, protecting this tissue from sugar. Statin drugs as well, protecting the tissue from sugar, and both having a reduction in the amount of vascular inflammation that the patient using these medications are experiencing. So it's really fun to kind of see all of this working together, and to see plant medicines, I think, and most pharmaceutical drugs are probably better teachers than they are therapies. So this goes back to, you know, addressing the barriers for us to be as healthy and as happy as we can be. Plant medicines and pharmaceutical drugs, it's fun to figure out exactly what they're doing in your body. Because if all, you know, these two things, statin drugs, striped maple, the impacts that they could have, cardiovascular disease, #1 killer, like all these huge things can be reduced down to one idea. And that is, they're just protecting your body from high blood sugar. That's it. And there's other ways that we could protect ourselves from high blood sugar. One of them is exercise, but another one is not having any sugar. Realizing that we are a carbohydrate intolerant species, and that we're probably, you know, if hyperglycemia, high blood sugar, is the insult that drives these chronic conditions, and that is the insult that both plant medicines and pharmaceutical drugs are trying to combat, then we need to just ask ourselves that, okay, so if that's the issue, how much carbohydrates do we need to be able to stay healthy? And then when we realize that the exact human requirement for exogenous carbohydrates to eat sugar is 0 over the course of an entire lifetime, that your body creates its own sugar. And when gluconeogenesis is driven by demand and not driven by supply, we could have the same effects on cardiovascular disease, or maybe even do more than what medicine and pharmaceutical drugs are capable of. So we see this a lot in fasting research. You know, you remove the sugar, and you see this a lot in the low carbohydrate research, carbohydrate restriction research, where we remove the insult. That tissue is able to have an incredible healing that happens. And so I like to think that plant medicines is a really great teacher, and can be used as a therapy as well. But it's fun. It's more fun to look at it as a teacher and say, you know what, if hyperglycemia, high blood sugar, is what's driving this condition, driving this issue in Indigenous communities, and our medicine is trying to protect us from that, and that we don't actually need any sugar whatsoever, how about we start to teach a little bit more, you know, when we're thinking about cardiovascular disease prevention, lower limb preservation, we're thinking about all these different things. Well, I think one of the most important things that could be in there is to listen to what these medicines and medications are doing and say, well, I think we could focus a lot on our you know, carbohydrate restriction strategies, and to look more at into dietetics as a valid form of therapy as well. So that's where I've been dedicating a lot of my time. I did want to share with you guys too another one really quickly, because I've been spending most of my time in this video should, oh, there it is. I've been spending a lot of the time learning, teaching, creating access to plant medicines throughout the province. But I've because I've been able to find more success in treatment by using nutritional intervention strategies, I wanted to share with you guys one of my ideas. I think is that plant medicines, if we're utilizing them as great teachers, then we could lower carbohydrate intake and control, manage, treat disease far more effectively than medicines and medications combined. But there's still other really, really valid avenues where plant medicines just are absolutely incredible. One of those is addictions, and another one of those is pain management. So pain management is something that I've been completely obsessed with since the beginning. I cannot believe the amount of pain management we're able to develop using Anishinaabemowin. This is a plant, sorry, not this one here, but this is a sphagnum bog, and I wanted to show you guys this plant here. It's Mukkim das. That was the flower. So it has a long red stem. If you look over a sphagnum bog and you see these little red snowballs, little red lumps poking up on top of the moss, it's probably a pitcher plant. You get closer, this is what the flower looks like. We use these roots to deal with back pain. So again, this is one of my favorite kind of intros or gateways into understanding plant medicines as an incredible therapy. This, you take little pieces of the root and you put it under your lip. So the medicine is absorbed sublingually. So it's in your bloodstream 10, 15 minutes. So like instantly. There are these types of saponins, which are a type of soap in the roots that get into your bloodstream. And the way that this medicine works is, with your spine. So you take somebody with sciatica, put this in their lip, and in 10, 15 minutes, their back pain is gone. And what this chemicals inside of these roots do is they draw out the calcium out of every sensory neuron in your lumbar. So there's no more pain being registered, no more DRG signaling, and this plant seems to establish a shunting mechanism to prevent reinoculation from calcium, so to prevent pain from developing, usually for quite a few days. So you take somebody with sciatica, put this roots in their lip, and in 15 minutes, a lot of the times they're standing up straight, sometimes for the first time in a decade. I got one community to recruit 70 people with sciatica to come in, and we put this in their lip. And that entire group was weeping because they haven't felt that amount of relief from that pain in years, regardless of the treatments that they were given, the pain medication that they had. So I think, looking at plant medicines, then I think we could look at them as great teachers, but also one of their very valid applications is going to be, in addictions, in pain management, and as well as, which I don't have the time to talk about today, but sometimes giving us the ability to use the medications that we need. I thought I would have time to talk about that, but it's already 12:54. But yeah, I at least wanted to pique our interest into looking at some of these different plants and realizing their ability to control and manage pain. The pain management sessions that we've had over the past decade are just like pretty ridiculous. And I think that if we're able to control, manage, and treat like most chronic disease with nutritional interventions, as I have for the past 6 years, another valid avenue where plant medicine can and should be absolutely considered as primary care is in pain management, and using something like Makakim Das for back pain, sciatica. The amount of so I better slow down and see if I could take on a couple questions if there are any, or cut it real close.
I worry about mainstream or new age appropriating Anishinaabemowin and over harvesting the plant and causing havoc across the ecosystem. What are your thoughts about sharing medicine preparation with a broad audience?
Yeah, huge, man. It keeps me up at night. It's really, really difficult. This is why for the vast majority of my time and energy is dedicated to preventing, controlling, managing, and treating most chronic diseases with nutritional interventions. So we don't need medicines. A lot of the times what we need to do is to fix the insult. Like nobody, if you have water in your gas tank in your car, you could put a turbocharger on, a supercharger on, put some conditioning fluids in, and if you don't get rid of the water in your gas tank, your car is not going to run properly. The insult needs to be removed. I don't think there's any amount of therapy that can compete with the healing that the removal of the insult is able to accomplish. So I do have huge issues with teaching about medicines, which is why, like we could look at most of the medicines that I teach about are plants that can handle over harvesting. They can handle a tremendous amount of insult. I'm not going to teach large groups about plants that may be more effective as a therapy, but those relationships are really hard to maintain. They require so much work, and over harvesting is too easy. I don't teach about those. I teach about the easiest and safest for patients, safest for the environment. And so this is a really real concern that kind of governs everything that I do. Absolutely.
Awesome, thanks. We have another one about, someone was asking about how the striped maple, how they would use it. How would you make a tea? Would you tap it like maple syrup, or using the leaves?
Oh yeah, I didn't even mention that at all. Yeah, so we use the bark, and we just put some bark in some hot water, let it steep, make some tea. It's a really, really rich red tea. That is absolutely delicious. Kindergarten kids, like pop and orange juice kids, will drink gallons of this tea. It's really incredible. It tastes so good. And you just make tea with the bark. I saw the other question there about the side effects. I think I covered the possible side effects of striped maple as being, that it protects that tissue from sugar, but not your kidneys, not your nerves, not your eyes. They take on that sugar burden. So those get damaged a lot quicker. So kidney function probably will decline quicker. Macular degeneration and glaucoma will advance quicker, and so will peripheral neuropathy. But your blood vessels are protected. I think that that's the only considerable side effect when it comes to striped maple, which also points to our requirement for removing the insult. And it doesn't have cholesterol lowering effects. Cholesterol is absolutely necessary, and a lot of the ideas we have on cholesterol mainstream are completely inappropriate. And no, you're not going to experience the same side effects as statins from striped maple.
As recommendations for hypertension and lower leg swelling, that might be a whole a whole other presentation.
You know what? Okay, so really quickly, hypertension, not so much. It's very hard to use Anishinaabemowin for high blood pressure. I know this because a lot of people who are closest and nearest and dearest to me have high blood pressure, and I know the risks. And I've tried everything. Plant medicine doesn't seem to be very, very effective at all at lowering blood pressure. But what I do know helps is just one story in one sentence. One woman, mid 30s, has never seen her diastolic lower than 105 in the past decade. Usually 160, 180 over 105. Every time she goes into the hospital for anything, they always want to admit her. Every pregnancy was preeclampsia, nasty. She removed the insult. She removed the carbohydrates one day. And when she woke up and checked her blood pressure the next morning, it was 70. And regardless of her stress, as long as the carbohydrates were eliminated or low, she was able to completely control her blood pressure and never see it go above 90, which speaks again to the necessary removal of the insult to address the actual problem and listen to our medicines and medications as the great teachers that they are to show us where the true therapies are.
Amazing. Thank you so much. So we're just a minute past. We made it. Thank you so much, Joseph, for sharing all of your knowledge. Thank you to everyone who joined us today. Again, maybe we'll look into having Joseph back because I think there's more questions and there's lots more to learn.
Let's go.
So thanks everyone and have a great day. We'll see you all very soon.
To me, let's.
Bye.